I have prepared for this. So anesthesia apparatus check recommendations are this is available emergency ventilation equipment. That is the first and foremost thing everything describes, and this is what she mentioned about the various checklists that is followed. Verifying backup ventilator equipment available. So here they describe this as high pressure system, low pressure system. Of course, intermediate pressures are also there. So check oxygen cylinder supply. This is a very important thing, especially nowadays. All of you are using the workstations. Many of you would not even have gone and seen where the spare cylinder is, because there is a display in all the workstations about the pipeline pressure as well as the cylinder pressure. So even if you don't know where the cylinder is attached in the workstation, make it a point to check whether that spare cylinder has enough gas in that by at least asking the OD assistant to open the cylinder and record the pressure, and then you can close that cylinder. So make sure that the oxygen cylinder, a spare one, is always available in any machine, whether it is an older machine or the workstation. That is a very important safety mechanism that we have to ensure, because the central manifold supply, there is always a chance that it can fail at any time. That's the situation. Unless you have a at least partly filled oxygen cylinder available in the machine, the patient's life will be in very great danger. So it is a very important thing that you have to make sure that you have a spare cylinder with at least half full. Preferably it should be a full cylinder. Even if it is not full, it should be half full, so that it can run at least for 3 hours without any discontinuity in oxygen supply. And then of course she described all the things, how to do the checking, how to do the various things, switching on the modern workstations all are a master switch. So unless you switch on that, the equipment won't work. And make sure that the spare backup battery is fully charged. That also is displayed. So if the battery charger is not on, make sure that it is connected and the battery gets charged while it is being working, so that there is no power failure causing the stoppage of the machine at in between the surgery. And scavenging system is also attached to most of the theaters here. And then breathing systems, you have all the way to check for them. And leak in the breathing system has to be checked by closing the valve and then pressurizing the reservoir bag, and then trying to squeeze it or see whether it is crumples because of small leak that is happening. And then the monitors, all the monitors like capnometers, pulse oximeter, oxygen analyzer, all these things have to be made sure. And final position, when you final status of the machine, all the vaporizers should be off. Airflow valve open, selector switch to both. It can move from bag to ventilator and ventilator to bag. All flow meters is 0, patient suction level adequate, breathing system ready to use. So these are the standard ventilatory check thing given in the books. And some of the hospitals have the checkout recommendations, and then who is responsible for that. That is also the accountability is made by finding out who should be doing this checking. And the responsible party can be the anesthesia provider or the technicians. These are the two people commonly involved in the checking of the machines. That's why I told you, don't believe the OD technician all the time. You also have a routine check. Learn to do that every day, at least during the first phase, so that you know that the things are in the proper way. Because many mistakes happen, especially after a weekend when Sunday OT is closed and Monday morning you go and you believe the technician and he has done a mistake and you have not checked it. That is where the problems happen. So it is called the weekend problem. So you have to make sure that you check the machine on the Monday when you start the first case, so that you are always on the safer side. So verify auxiliary cylinder, verify patient suction, and turn on anesthesia delivery system, confirm AC power is available, and then required monitors are there. This is what she said about the 15 things that are to be done. Okay, so here this is to be added. Who has to be responsible? You cannot put the blame on technician and say he was responsible. It is always as a provider. Ultimately, if anything has gone wrong, it will be you who will be responsible. Only once you become a registrar or a consultant, you are going to be responsible for the mistakes of your persons working under you. So that is the reason why I'm again and again insisting that you better check it yourself once you even the technician has done their routine checking, and then these are all the things. So again, I think this is printed twice. Items to be completed. Verify patient suction is adequate to clear the airway. This is how you check the patient's suction power. This is given in the option DARS. So when you attach the suction tip to your finger and there is no other support, the suction tube should be stuck to your finger. And what should be the pressure at that time? Vidya?
Sir?
At what pressure the suction will be sticking to your finger without falling down? What is the normal suction that is required?
It's minus 200 to minus 300.
300. Minimum minus 300. Okay. Negative pressure of 300 millimeters of mercury is the right answer. Okay. So this is how you check for the adequacy of suction. And this is how you check for the circuit leak. Okay. So verify auxiliary oxygen cylinder and self-inflating manual. I'm just added some pictures for you to remember what are all the points that you have to check, and squeeze the back to ensure that the air flows out of the elbow. And then A is the occlude the elbow connection and squeeze the back to check the inlet valve. That is the circle system. The inlet valve should open, and the other components are to show there is no significant leaks. Then occlude the reservoir tube inflow, then collapse the bag to assess the outlet check valve. This is how you do that. The bag should remain collapsed if the flow is occluded. And turn on the anesthesia delivery system, confirm that the AC power is available. So this is how the master switch will be there. Make sure that it is on. Verify availability of required monitors and check alarms. So check all this alarm on the display and then go for that. Verify that the pressure is adequate in the spare oxygen cylinder and cylinder mounted on the anesthesia machine. So nowadays you have the display and you will have the symbol of the cylinder also in many machines to show whether it is a pipeline pressure or whether it's the cylinder pressure. Here it is written as cylinder, but some machines display the symbol or the drawing of a cylinder itself. And verify pipe gases are at least 50 psi or greater. So this is you can see this is the picture to show how the pipeline gas, and even in the pressure gauge there is a safety feature included in that. The needle should be within the green range. If it comes down below that, that means the cylinder is getting emptied, and then you have to immediately make sure that either the backup cylinder has to be opened, or you must inform the manifold room technician to make sure that constant supply is available. And this displays the gases that are being delivered, their pipeline pressure and the cylinder capacity, everything is given here. And this is the general leak test, how you perform this. So vaporizer leak test, which is performed by attaching this tube with a bulb to the common gas outlet. Then you squeeze the bulb. It should remain deflated at least for 10 seconds. Then only it indicates that there is no leak in the anywhere here. Now here you can see the bulb has become filled up and the leak has been pointed out at this junction. So it is very difficult to detect all these small leaks here unless you do this test very correctly. And categories of check: emergency ventilation equipment, high pressure, low pressure, scavenging system, breathing system, monitors, and final position. This is called the 8 categories check. And then you calibrate oxygen monitor, check machine gas delivery, circuit for integrity, ventilation for function, and exhaust for function. And the 3 most important preoperative checks are: calibrate the oxygen analyzer, then low pressure circuit leak test, then circuit system test. These are very, very important. And canister vacuum problem, post disconnection or canister switched off, inserted incorrectly. Many a times after discarding the exhausted soda lime and filling it with the newer one, when they are inserted, you will find the circuit not filling up and always a leak. So make sure that if the soda lime replacement has been done in the morning before you start the case, make sure that the circuit is without any leak at that level. And hose disconnection from the holder, tubing disconnection, and flap valve closed, canister filtered or canister too full. Sometimes, the new OT technician may fill up the soda lime beyond the line which is given as a safe level. So if they put too much of the soda lime into the canister, that also will cause a leak. Will not get seated properly, and there may be a hose link. And calibration of the oxygen analyzer, all of you must know how to do that. So you first expose the analyzer to the room air and it should show only 21%. After that, you connect it to the machine and expose it to 100% oxygen, and then do at various concentrations of oxygen nitrous oxide. So everything should be correctly displayed. When you expose it to room air, it should show 21%. When you use only oxygen by opening the flow meter, it should read 100%. And when you give oxygen and nitrous oxide in various proportions, it should read correctly. So that is how the oxygen analyzer has to be checked, and the checking should be done. Okay? So this is a question that has been asked quite